Hello everyone, welcome to an episode of TooHealthTalk. The show gets to share each health challenges in a very simple and honest conversation. On today's episode, I have a special guest. Before we continue, please for you to know what we're doing here, please subscribe to our channel, like and share this video to someone that might need it. On today's episode, we have our first dental doctor on the show, the person of Dr. Flourish Naji. Welcome to the show, Doc.
Thank you very much. Thank you for having me.
You're welcome. It's a pleasure having you on the show. Even with like your busy schedule, you were able to like make it to this place.
It's okay. Thank you.
Yeah. So today's topic is a very sensitive topic that people don't like to talk about.
Okay.
Like a lot of people don't know much about dental care. Even talking about pediatric dental care. But before I ask you some questions, I would like to know like why were you so passionate about pediatric dental care?
Okay. Personally, I feel a lot of things that we go through now are things that if we knew better when we were younger, or if our parents knew better, we would have avoided them. So I would say I'm passionate about it because if you catch them early enough, you won't get to have further issues, or they won't have to suffer what we feel like we're suffering now. So yes, that's basically it. And then pediatric dentistry is not just about children, also the children we call spectrum children, the special needs children. Yeah, I feel like there's just not a lot of it around. So yeah, I'm just passionate about that.
So why is dental care for children very important?
Yeah, like I said, it's because most of the things that adults suffer now, if they knew better earlier, they won't be suffering it. And if some parents knew better or earlier, their children wouldn't have come down, with anything. So it's very important because the baby teeth, as much as it's a milk teeth, or we call it primary teeth, it plays an essential role for your child, and also for the permanent tooth that's going to come out. Yeah, so it's very, very important.
So now me personally, growing up, I do not remember going to the dental clinic for once. Like
Open your teeth, Okay, go ahead.
so, like, are there mistakes are there biggest mistake that our parents are making, or like they're making for their children, like when it comes to dental care?
Yeah, yeah. I would say, let me give an example. I had a patient come to the clinic one day. She brought a 4-year-old, and the child was in pain, and her and her mom could not sleep the night before. And when she came in, I was like, "Oh, your child has quite a number of caries, like decays on the teeth." And she was like, "What am I supposed to do?" I said, "Okay, you're supposed to, brush." I kept giving her some. She was like, "Well, her mom told her not to brush her child's teeth until." I was like, "When? How? Did you get?" And now you are now with me, and you're gonna pay money to have that thing solved. Did you get?
Yeah.
So if you're aware of what you need to do, you won't come down. Like, you won't have these issues.
For you to talk about now children like that, this story you just shared now,
Yeah,
both of them could not sleep.
yeah,
I've had cases where they'll say that children do have like is it diarrhea that is because of their trying to like
teeth.
to
Yes,
yeah
yeah. Bring out the
new teeth.
Yeah.
Is that true?
Okay. No, it's not true. Teething does not cause diarrhea.
Or
Teething, yes. And then the popular one, teething causes fever. No, it doesn't cause that. I would say because of development. When a child, or whenever anybody is developing anything at all in the body, they are like a cascade of events, cells, replication, and all that goes on in the body. So yeah, there may be a reaction by the body, and people react differently. But one of the main reactions that you probably see, maybe just a slight raise in temperature, but no fever. And then you'd see probably a child is drooling, or maybe there's a swelling around the area where the child wants to, but not outright fever. And vomiting, like what concerns teeth and vomiting and all that. So I see a lot of people, say, oh, I gave my child this teething medicine because I feel like this fever is because of, no, no,
So it's not true.
it's not true.
Because me, I can remember my younger ones. I can't remember myself, but my younger ones, when they were growing up and they
Yeah.
were teaching, they were having fever most time. But why are they always having fever that period? Why?
Okay, according to studies, we know that the first set of teeth comes out around 6 months.
Yeah.
They're about 6 months of life. And that's when a child starts crawling, starts picking things and putting in the mouth. So it just probably just coincidence that okay, the child is getting an infection from one of these things, and then that's the same time teeth is coming out. Maybe one tooth is coming out, and then they just feel like, oh, the teeth is coming out because of the fever or something like that.
As me and a doctor now, I will not believe you because I've had personal
Even
experience
myself,
of.
sometimes I ask myself, Flourish, do you believe this thing you said? But honestly, that's the truth.
So when is the best time to visit the dental clinic with your child?
If I tell you, will you believe me?
Let's see.
As soon as you have a tooth in the mouth, as soon as the baby has a tooth in the mouth, just go to see a dentist. Just go. Even if he's going to say hi, okay, oh, we just figured we have like one tooth growing in the mouth. And we go home. We don't have to do anything for
Is that
you.
expensive?
Expensive care.
Because most of the reasons why people don't visit the dentist is because of it's
It's
expensive.
Not expensive. Care.
Dental care is
Because,
expensive.
yes, but does the child have any issue? No, you're just coming to say hi to us. You're just coming to say, oh, we have like a new teeth or a new tooth, sorry. Basically, so what are you paying for? Probably just consultation.
Your consultation fees how much?
We'll talk about
So
okay.
if you're talking about brushing of the teeth for
Okay.
children, what's the like best age and what's the best way to start brushing a child's teeth?
Okay, first things first, you start brushing a child's teeth as soon as they have tooth, right? Well, for maybe like 0 to 2 years, I usually tell people you can do without toothpaste for 0 to 2 years. You just get a clean towel that is just dedicated for that child to clean. Maybe you can have several of them. Then you get water and clean. Just clean around their gums, their tongue. The good thing about babies at that age is that their mouth is somehow self-cleansing because they produce a lot of saliva. They don't keep their mouth shut. There's just salivary flow, and that helps with cleansing, right?
Yeah.
But we recommend that 0 to 2 you clean up with maybe like a towel. Just make sure the mouth is clean, the tongue is clean. Then from 2 to 5, you could start introduce toothbrush to them, toothpaste, but just a smear, like as tiny as possible. It's not about the amount of paste you use, and then you clean. But that's 2 to 6 years. I recommend, or 2 to 5 years. I recommend that you clean for them. Don't let them clean by themselves. You can decide, okay, they can do the cleaning in the morning because you just want to be sure that they are learning, or they can do the cleaning in the morning, and then you do the cleaning for them at night. That's just for a double check, because that age is still, their motor skill is still a bit questionable, their concentration and all that. Then from 6 to 10, we recommend that you observe them. You let them do it, but you watch them do it, because sometimes you just lick the toothpaste and they're done.
True.
Right? And then above, they are free to do whatever they want to do.
Are toothpaste harmful to children?
No, they're not.
They're not.
What do you mean by are toothpaste harmful to
Like
children?
when you get to use toothpaste and like for example now 2 years old now or a 1 year old child now and using toothpaste for them, is that harmful?
No, it's not.
It's not harmful.
No, it's not.
Or
But preferably, because all these things are chemicals, and the people that are making it, we cannot tell. Some people are making toothpaste for business, right? And some people may not be legit. You understand? So, as much as possible, try not to let them swallow it.
okay. I also want to ask, what's will I say food gets to damage the child's teeth?
Okay, sugary foods generally, especially sticky sugary foods like chocolate, sweets, just anything that gets to stick on your teeth for a long time. Yeah.
Or like chocolate and sweets?
Chocolate, sweets, biscuits. There are some biscuits now they are making that it needs you to brush out before they come out
They
of your
come out.
mouth. Yeah. So one thing is anything that will keep sweet things on your teeth for a long time. Yeah. Those are the things that we preach against.
So what is the best, like, will I say best food that helps a child develop stronger teeth?
Just eat healthy vegetables,
I was
just
thinking you say
general,
too much of breast milk or helps the child to
too much of
progress.
breast
Like,
milk.
yeah, when you
Ah,
breastfeed a child like properly, the tooth get to,
get better.
yeah.
No. It doesn't necessarily mean that. But breastfeeding, we all know that it's very good for a child growth and development. But funny thing is that that breast milk itself, if you even keep it in the child's mouth for a long time, can cause issues for the child. Yeah. So yeah.
Wow.
Yeah,
So too
yeah,
much of
yeah.
breast milk
No,
in
I
the
did
child
not. I did
mouth.
not. I did not say that. I said whatever. The point is that there's how caries form, how decays form is when you have like anything sugary, not even just sugary, like anything in your mouth kept for too long. So the bacteria, because mouth is colonized by good bacteria, bad bacteria. Yeah. So the bacteria in the mouth feeds on whatever you have in your mouth and they produce something acidic. Now, it's that acidic thing that dissolves your enamel, that dissolves your teeth and gives it that hole. Yeah? And then the more the hole forms, the more there is a bowl for more food to get stuck. Do you
Oh.
get it?
So I wanted to know, like, what's the most common food that gets to damage a child's teeth?
Okay, anything sticky, anything that has the ability to just stay on the teeth for long, yeah, is a culprit.
Oh,
So like chocolates, biscuits, sweets, even sugary drinks, if you keep it in your mouth for long, anything that you just have to keep in your mouth for long can damage the teeth.
I
Yeah.
have like breast milk gets to damage the child's teeth.
Yes.
Wow.
Just like I said, anything you keep in your mouth, especially anything that has sugar, keeping your mouth for so long is going to damage your teeth because here's how caries form.
Yeah.
When you have food in your mouth for a long time, because your mouth is not was designed to have bacteria, right? The bacteria in your mouth feeds on whatever you have, and their byproduct is like something acidic, and that's what dissolves the teeth and gives it a very tiny hole. So it just probably starts as a very tiny hole, and then that's like more room for more food to pack in it, and just the process just keeps going on. Yeah. So anything you keep in your mouth for long has the tendency to give you caries. Any
So
food,
so now
yeah.
women that used to eat any small thing now, if their child's cry, they just put breast in child's
No.
mouth.
That's different.
But
That's
but the breast gets to stay long in their mouth now.
that's not so long. Not so long. Like it doesn't happen. It doesn't happen just how will I say overnight. Do you understand? It's just like a continuous habit. It takes time. It takes time.
Oh,
Like if a woman puts a breast milk in her child's mouth, maybe for like how long you feed your child for like 6 hours stretch? No, you won't. You still get it out, and then the baby moves his mouth, and everything goes. But just for like women who maybe just don't want disturbance, maybe in the night, they just put maybe like they produce breast milk and put in like a what's this thing called? A feeding bottle.
yeah.
And they just stick it in their mouth and the child just carries the feeding bottle like everywhere he goes for over hours without any form of cleaning. Yeah, that one can cause
Damage.
damage,
Yeah. So
regardless of the fact that it's breast milk.
breast milk. Wow. So what is the early signs like parents should look out for?
I will not say look out for early signs. I would rather say come on a routine visit to a dentist because even if I tell you, oh, look out for this sign, caries can even look like this very pure white dot on the teeth, and you may not be able to see because you're pretty much not trained to look for something like that. Do you get? So I would advise not necessarily look out for anything, because by the time you're finding anything, it's gone a bit bad. By the time a child is complaining of pain, because one of the very first things that you'd even see or hear is, oh, mommy, I'm having pain on my teeth. The thing has gone really bad. Do you get? For you to be having pain. So I would rather say try and try and ensure routine visits, and then we find it, we solve the problem immediately.
Or so if you have like a problem now with your tooth now, how how often, like when I say having it, how often should you visit
The
the
dentist.
dentist as a mother now? If you want to take your child to the dentist now, like how often? For example, now I know they say that you must visit the dentist like twice every year.
Yeah.
Yeah. So for children, is this still the same for children?
Okay. All things being equal, we just say a year, once a year
For children
for children without issues.
issues. Okay.
Right? But if a child is a probable, like we feel like, oh, this child is not really, like the oral hygiene is not well, or maybe the child has maybe mal-aligned teeth and all that, we increase the time to 6 monthly or 3 monthly. We just see you until we're sure you're past the age of dependence, I would say.
Oh, another thing just struck my that really wanted to know
Okay.
about having to grow like a good teeth. Is it will I say is it generic? Like for example now, for someone to have a bad teeth,
Is it generic?
is it yeah, the parents has like bad teeth also.
Not necessarily. What I would say is maybe composition of your saliva may play a role in you being more prone to having caries, but you were not born with a bad teeth.
Oh,
But maybe just some certain conditions may make you more prone. Does not necessarily mean you have a bad teeth, or you were born with a bad teeth, or you have, like a lot of people say, oh, my gum is sensitive, things like that. No. Even if you have chances to get, even if you're more prone, if you're following the right oral hygiene practices, you won't come down with caries, you won't come down with issues. Yeah.
wow.
So there's nothing like inherited bad teeth, no.
Oh, I was thinking, what of the formation, like the way your teeth forms? For example, now if your parent is having open teeth now, is it like certain that the child is going to have open
Not
teeth?
certain, but definitely it's then they may just be linked. Yeah.
Oh, okay.
Yeah,
So now,
definitely, but not bad
not
teeth,
bad teeth.
not decays, not maybe the way the teeth comes out. Yes, but not decays. Decays are self-induced.
So now you also talked about if a child gets to grow the teeth from 6 months, right?
Yeah.
So now if a child is like up to a year and there's no teeth, should the parents be worried?
No, give or take 6 months. Is maybe when the child is like a year, 6 months, we start getting worried.
A year, 6 months, parents should getting worried.
Yeah, a year, 6 months. Yeah, from a year, yes, you'd be getting worried. You could, but not so worried. It's now when maybe a year, 6 months max.
What's one like before we go? So what's one advice you really give to parents about their child, like or future parents about their child's dental health?
Okay, I would like to give this advice by explaining the usefulness of that primary teeth that you're looking down on. First of all, we already know the uses of teeth. They used to chew and talk. It helps with speech. So imagine that you neglect that primary teeth and your child is not able to chew what he needs to chew, and you're coming down with a malnourished child. I'm sure you wouldn't like that. Secondly, if your child can't pronounce some certain words because they lost their teeth early, I'm sure you would not like that. And then thirdly, this is something that a lot of people don't really know. The primary tooth serves as a guide for the permanent tooth, right? So what happens is that the permanent tooth for most of the permanent teeth comes out underneath the primary tooth, right? And the events just make the permanent tooth just keep resolving the roots of the baby tooth, and then it just keeps doing that until the baby tooth gets shaky and then falls out. So that thing is just like a guide for the permanent tooth to come out properly and in the right position. So if your child, maybe out of negligence, loses their baby tooth early, the permanent tooth can come out in any, in a malformed or malaligned, position, and then you'd have to spend a lot of money to, fix it. Though we are really open to taking your money. Yeah, so I think with this explanation, you should know what to do. It's very important for you to know to care for your child's dental health. I usually advise that to us, what's more important? We say brush in the morning and brush at night. And that's because, yes, in the morning, you have to go speak to people and all that. So you don't want to go with a smelly mouth. But what's more important to us is brushing at night. Because that night brush we're trying to prevent you from having food stock up on your teeth throughout the night, because that is when there's enough time for the bacteria to enjoy itself and do whatever it wants to do to your teeth. So please and please and please start in time. You can come in and have your dentist see you. Yeah, of course, me. Have your dentist see you. And if there are any issues, we start very early enough to solve them. And you won't have to pay for something bigger in future. Yeah. I think there's something that they usually say, time heals all things except
true.
dental issues. Yes.
So
Thank you.
you just said something now that struck my mind about brushing in the night. So you're saying now medically,
Yes.
brushing in the night is better than brushing in the morning?
You've seen now.
Let me know now.
Yes, it is better than. It's not better than it shouldn't replace your brushing in the morning.
Okay.
But I'm just saying that it's throughout the day you're talking to people, saliva is just moving everywhere. But at night your mouth is shut, and just like that's a very very good medium for bacteria to actually feel free and enjoy themselves and do whatever they want to do. So since we can't take out the bacteria because it's natural, let's take out what they feed on. So that's why I oftentimes preach brushing at night is actually the more important one.
Wow. So even for children, brush
Everybody. If you do that, you won't even get to see me except you want to say hi to me.
So
Yes.
lastly, I just remembered also something I wanted to ask you also. When is the best age for the milk teeth to pull out?
Different
from everybody.
We have a standard. We expect that at 6 to 7 years, your first permanent tooth start popping out. But we've seen 5 years with their first permanent tooth. We've seen it delayed to even 7, 8 years for them to even pop out their first permanent tooth. So
I was thinking I lost my teeth when I was 15.
Yeah. You keep losing them. I'm saying the very first permanent teeth will come out around 6 to 7, but you just keep losing them bit by bit. There's one you lose by 9, there's one you lose by 10, 11, and you even grow one by some 18 to 20, 22.
Wow.
21, 22, yes.
So when is the final time for you to grow teeth? Is there a final age that, okay, this age you cannot grow teeth again?
Yes, the third molar, that is usually the last to come out, comes out at the age 18 to, let's say, 21, 18 to 21. But sometimes they are not fully erupted, maybe they're just stuck, and then sometimes they just keep trying to get out until maybe 24, 25. So 25, if maybe your third molar has not come out to the full position, then there's no movement again. It's past. So maybe I'll just say 25.
25.
Yeah.
Oh.
Past 25.
Okay. Thank you so much for sharing your knowledge with us here on the
Thank
show.
you. Thank you.
And it's like I think I've learned a lot from this particular topic.
But it shouldn't stop you from coming to see us anyway.
Yeah, I shouldn't stop you from coming to see Dr.
Yeah.
Naji. Thank you so much, Doctor, for coming on the show. And
Thank you.
please, if you've watched up to this moment, I want to thank you for watching up to this moment. And for you to cover what we're doing here, please subscribe, like, and share this with someone that might need it. So it's an unborn, or is it unborn woman? Or is it marriage? So I'm like, say, a woman preparing to get married or to like give birth to
And you
a child.
yourself.
Okay,
And
I
you
mean, so,
yourself.
yeah, I learned that, I should be brushing, twice a day, even though I do, but sometimes I just get like, okay, forget.
I just forget. Yeah, but at least to a good extent, try and do it.
I'm sure. So I will not come and, give you all my money.
Don't worry, we're willing and available.
So see you on our next episode. Bye.
Bye.